Welcome, everyone. We are going to be talking about one of my favorite subjects today, which is not functional exercises, functional outcome measures. They coincide with functional exercises, but functional outcome measures is basically things that you can do to track your progress so you can see how you're doing and is what you're doing actually getting you the results that you're looking for. So we're going to dive all into it. If you are brand new, a special welcome to you. If you are a veteran member of our Moving with MS support group, a hello to you. Thanks so much for tuning in. If you don't know who I am, I'm Dr. Gretchen Hawley. I'm a physical therapist and multiple sclerosis certified specialist, and I specialize in helping people with MS get stronger and walk better through functional exercise and neuroplasticity strategies. So this is our Moving with MS virtual support group that I partner with MS Visa News for. And a huge thank you to our supporter, Viatris. This would not be possible without them. All right, so as promised, functional outcome measures. We're going to be talking about what they are because it's important to know what they are in order to be able to utilize them to the benefit that they can be for you. So we're going to talk about what functional outcome measures are, the different types of functional outcome measures, examples, and at-home testing. So I am going to be doing some demonstrations back here to demonstrate how to actually utilize these at home. So first and foremost, what are functional outcome measures? Functional outcome measures are a test that you can do that quantify a patient's improvement of function throughout an episode of care. So typically these are done in a physical therapy clinic or occupational therapy or even your neurologist. So an episode of care just includes the amount of time that you are with that healthcare professional. If it's physical therapy, it's going to depend on your insurance, but it might be a few weeks, it might be a few months, maybe a year, probably not if you're in the United States, but that is an episode of care from your evaluation until your discharge. And throughout that time, you're going to be doing functional outcome measures. Whether you know it or not, your physical therapist or occupational therapist is going to be testing you in certain ways. And your neurologist can do this as well. And we're quantifying measurable improvements as we're working together. So why is this important? First of all, it's important for you and your goals because when you're going to see a neurologist, physical therapist, any healthcare provider, more likely than not, one reason is because you're working on goals. You're working towards getting stronger or walking better or getting in and out of your car easier, standing up from the floor. And you want to know if you're on track towards reaching those goals or not. Because the reality is when you have multiple sclerosis, it can take a long time to reach your goals. And if it takes a long time, that can often mean that you're getting discouraged or defeated and feel like, well, must not be working because it's taking forever. But if you do functional outcome measures and you do these tests, whether it's at home or with your neurologist or physical therapist, it can help you realize that you are getting better because you're seeing improvements in these tests. And yes, it might take a little bit longer for you to see these improvements in real life situations, but it can show you that you are improving, or it can show you you're not improving. And maybe that means your MS is changing, or maybe that means you're not doing the right exercises for you and your goals. So maybe you do need to start working with a physical therapist again. So the number one reason why functional outcome measures are important is for you to track how you're doing physically with your strength, your balance, your fatigue, your walking, etc. But it's also important for insurance reasons. At least in the United States, we have to submit so much information to try to get as many physical therapy visits as possible with our patients, especially when it comes to MS, because a lot of the times our goals might just be to maintain strength levels, maintain balance, maintain fatigue, and just not let it get worse. But with insurance, if they see maintenance, they might see that as a bad thing. But if we can at least show via these functional outcome measures that you're maintaining or even improving, you're more likely to get more physical therapy sessions versus being cut off really quick. So I'm curious, let me know in the chat how often you see your neurologist. And I don't have this question up here, but I also want to know, how often do you see your physical therapist? And let me just see in the chat who's tuning in. We have Terry from Canton, Julie from, I can't remember where you're from and you didn't say, Lori from Orlando, Florida. Oh my gosh, Lori, I hope you did okay with the hurricane. Deborah from Minnesota, Julie from California. Let's see, Barbara from the Bronx, Dion from Southern New Jersey. Barbara says she sees her neurologist 2 times a year. Yeah, so most people, let's see, Deborah says neuro is every other year, PT monthly. So most people that I know with multiple sclerosis see their neurologist either once a year or twice a year. But as several people have admitted, sometimes it's every other year or it's just as needed. And if you're only doing functional outcome measures at your neurologist's office and you're only seeing them once a year, twice a year, once every other year, whenever it's necessary, you won't be tracking how you're doing, and you won't know if you're on target with what your exercises should be doing for you. Same with the physical therapist. Oftentimes, when you're working together with a physical therapist for physical therapy sessions, you'll be working together maybe once a week up to 3 times a week for anywhere from 6 to 12 weeks, depending on your insurance and what they will allow. Maybe it's less, maybe it's more, but then you stop and you don't start physical therapy again for maybe 6 months or a year. Again, mostly it's depending on your insurance. And if you're stopping, you won't know if your, excuse me, if your exercises are right for you, or are they getting too easy and you need to progress them? Are they too challenging and you need to modify them? Keeping track of how you're doing physically and measuring your progress or regressions or maintenance is so important to understand what you need to reach your goals. And if you're only seeing your neurologist once a year or infrequently, and your physical therapist infrequently once you've been discharged, that can be a problem, because so we want to stay on top of this. Okay, let's see what everyone else is saying. Joe says 2 times a year for the neurologist. Hi, Joe from Ohio. Barbara says physical therapy for 8 to 12 weeks per year. Yeah, 8 to 12 weeks. Neurologist once or twice a year, and just finished PT at the MS Center. Alicia says neurologist every 4 to 6 months. So that's probably the most frequent that we've seen on this call. PT online only at this time. Kanita, welcome. Neurologist every 4 to 5 months. Okay. I've been in PT for the past 6 months. Awesome. You must have good insurance. Kanita says neurologist, she sees her neurologist 1 to 2 times per year, no physical therapy. Julie, three months and take blood. Lori had beautiful functional outcome measures from the MS Center. Awesome. So you know exactly what we're talking about. I go back again next year due to insurance. Yeah. Bay Area a couple times per year. PT said I don't need to come in weekly because I'm not healing from an injury. That's another story. I've started working on at-home PT. Awesome. Okay. So generally speaking, a few of you said you see your neurologist about 4 to 5 times a year, but mostly it looks like once a year. And for physical therapy, it's kind of off and on. Okay. So let's talk about who measures these functional outcome measures. So as I've already mentioned, your neurologist, the ones that might be common for your neurologist to do might be the 9-hole peg test, the 25-foot walk test. Sometimes they'll do like a 600-meter walk test, depending on how the clinic is set up. And they'll have you walk bigger loops or laps around the building. But those are measurable tests. They're measuring how fast you're going or the distance that you're going. Physical therapists also love functional outcome measures. We too will do things like the 25-foot walk test, timed up and go. We're going to get into a bunch in a bit here. Occupational therapists also will do functional outcome measures. Typically, those are more so related to upper body strength or hand and fine motor, gross motor skills, sometimes balance. Speech and language pathologists, pretty much any healthcare profession has functional outcome measures, these measurable tests to see how are you doing with specific symptoms like weakness, balance, energy, fatigue, etc. So when it comes to functional outcome measures, there's two types. One is subjective and the other is objective. So the way that these are worded, if you hear this in conversation with your healthcare providers, is subjective functional outcome measures or objective functional outcome measures. Subjective functional outcome measures are written. So they're still quantifiable, but they're written. And so they often look like questionnaires. So two of the ones that are most often done with physical therapists are the MSWS-12, which stands for the Multiple Sclerosis Walking Scale 12. And then the other one is the Modified Fatigue Impact Scale, or the MFIS. So let's talk about what each of those look like. Let's start with the last one. So the MFIS, the Modified Fatigue Impact Scale. This is a series of 20 questions. And the 20 questions ask about lots of different types of fatigue, ranging from physical fatigue, mental fatigue, and social fatigue. And the way that you answer the questions is you consider how your fatigue has been within the last 4 weeks. And then you rate various statements on a level of 0, meaning never, up to 4, which is almost always. So an example might be, I have been unable to think clearly. If that has not been a problem for you at all, you would score 0. If you feel like, whoa, that's like my daily life, I cannot think clearly, that's a 4 because you almost always feel that way. Another one might be, I've had difficulty making decisions, or I have had difficulty organizing my thoughts when doing things at home or at work. Let's pick another one here. I've been less alert. I have been less able to complete tasks that require physical effort. Let's do one more. I've been less motivated to participate in social activities. So there's 20 statements like this, and then you rate all of them from 0 to 4, and then you add them up and see where you're at. So this is a way to measure your fatigue. Now, one thing that's challenging with all functional outcome measures, and what you might be thinking right now, is every day is so different. So because of how, when you look at your fatigue over the last 4 weeks, every day could be different. So we do kind of have to take these with a grain of salt, but at least it's something. At least it's some measurable outcome that we can use to compare to how we were a year ago or 2 years ago. So let's move on to the MSWS-12. So this is the Multiple Sclerosis Walking Scale 12. So this is 12 statements that, similar to the Modified Fatigue Impact Scale, you need to rate from 1 to 5. So 1 would be not at all, and 5 would be extremely. So with the MSWS-12, you're considering how your walking has been and how your MS has affected you over the last 2 weeks. Again, the last 2 weeks, every day could be different. So you kind of are just going for the average. But some examples of what this questionnaire might ask would be, in the past 2 weeks, how much has your MS limited your ability to walk? 1 would be not at all, 2 would be a little, 3 is moderately, 4 is quite a lot, 5 is extremely. Another example, in the past 2 weeks, how much has your MS limited how far you're able to walk? Another example, in the past 2 weeks, how much has your MS slowed down your walking? How much has your MS made you concentrate on your walking? So you're rating these 12 statements from 1 to 5. And 5, the more 5s you have, the more likely your walking has been affected within the last 12 weeks. But you add it all up, and then we can compare to how you were doing previously, whether it was 6 months ago, 1 month ago, a year ago. Because MS is so variable, personally, as a physical therapist and MS specialist, I take month by month scoring of these, because sometimes you'll do them with your PT every month or maybe every 6 weeks. I take those comparisons with a grain of salt. I am more so looking over time. Overall, how was your test today and maybe the last 3 tests compared to a year ago? That's more so what we're looking for, because MS can be so different every day. So let me know in the comments if you have done either of these tests. Let me go back over to the comments. I love the measurable test, gives me things to shoot for as goals. Yeah, I've worked with so many thousands probably of patients by now with multiple sclerosis. And I've had some of my patients take down the scores that they get from these, and they make a little graph for themselves, and they keep it over the years. My neuro has never tested me because I take my scooter, not my walker. Okay. I prefer objective. Yeah, we're about to get into objective. If you use a walking aid, cane or walker, do you answer MSWS 12? That's okay. This is a really great question. So if you are using a mobility aid of any kind, and honestly, not just mobility aids, but even electrical stimulation, like the Bioness or the walk aid or the Sionic neural sleeve or an AFO, if you're using anything during your time that you are comparing, so for the MSWS 12, and you're thinking, okay, in the last 2 weeks, how much has my MS affected my walking? Keep that in mind and write it down next to it. I am a huge advocate of taking notes on the specific things that are going into your thoughts, and when we get to the objective ones, we'll continue this, but write down notes on that so that the next time that you fill this out, you know where your mind was at previously. Because if you're thinking, okay, you're taking the MSWS 12 and you're thinking in the last 2 weeks, how much has my MS affected my walking? And you're thinking about your walking with mobility aids, you might score yourself pretty good because your walking hasn't really been affected because you're using your mobility aids and it's allowing you to walk well. But then the next time you take this test, if you're not thinking about mobility aids, if you're instead thinking about, well, how is my walking been affected when I'm not using mobility aids? That score is going to look so different. So write down those notes if you're doing this yourself. If you're working with a physical therapist or neurologist, make sure they are writing down those notes. But if you're doing these at home, write down those notes so that you keep it as most similar as possible. And maybe if you're like me and you love trial and error and just comparison, maybe you take the MSWS 12 twice, once with the mindset of with using mobility aids, and then another time without using mobility aids. So on the same day, you answered the same questions, but just different situations. Same with the modified fatigue impact scale. So keep that in mind as you're doing these tests at home if you are someone who does use a mobility aid or AFO, ankle brace, electrical stimulation, anything. Let me see here. I've done both. What kind of support for MSWS? Okay, I think that answered that question. Now that you've shared and explained these, I have better understanding of these benchmarks. Good, I'm glad. Okay, so now let's get into objective outcome measures. So objective ones are my favorite. Subjective are great because it doesn't require any physical energy from you. It does require some mental energy, because you do have to think about the last 2 weeks, the last 4 weeks, how is your fatigue, your walking been, but there's no physical exhaustion from it because you're just sitting down. Objective functional outcome measures are the ones where you're moving. These are often timed, and it's looking at distance or the time it takes you to walk a certain distance. So some of the most common ones that physical therapists will use, and the ones I'm about to mention, are shown in MS-specific research to be the best ones to indicate if your exercise routine is helping or not, and if your MS is progressing or not. So the first one is the timed 25-foot walk test. And for all of these, I'm going to demonstrate how to do them at home as well. But this might be one you do at your neurologist, but it's definitely going to be one you do with your physical therapist. The 2-minute walk test or the 6-minute walk test. The timed up and go, also called the tug. The 5 times sit to stand. The 30-second sit to stand. And the dynamic gait index. The dynamic gait index looks more like it's assessing your walking and your balance as well. There's also another one called the Berg balance test, but again, according to research, the dynamic gait index is the more preferred choice. Okay, so we're going to go through each of those ones that I just mentioned, and we're going to talk about at-home testing. Because again, as I mentioned, if you're only going to your neurologist once or twice a year, or even if it is every 4 to 5 months or 4 to 6 months, what's happening in the meantime? You should still be exercising, and ideally you're tweaking your home program for your exercises accordingly based on how you're doing. Or if you're not in a current phase of physical therapy, it's really important to keep track. So how do you do that at home? So the 25-foot walk test. In the clinic, when you do that, you're going to be measuring 25 feet, well, not you, the physical therapist or the neurologist will have 25 feet measured. You start at one end and you walk down to the other end of the 25 feet and you're timed how long it takes you to do that. I'm going to share something at the very end of all of these objective outcome measures and testing at home, but I just want to share it right now in case it's on your mind. You're going to want to take notes. You're going to want to write down not just what time it took you to walk those 25 feet, but were you using a rollator? Were you using an AFO? Did you trip at all? What was the quality like? Because coming from a physical therapist and from working with thousands of people with MS, your score, as you're improving, your score might slow down. And if the only thing you're looking at is the time it took you, then you might be missing a whole lot of information. You might assume, oh, let me throw in the towel, I'm not getting any better. But if the first time when you were going faster, you were tripping with every step, scuffing your foot, maybe swinging your leg around, really poor posture. And then the second time you were going slower, but you were bending your knee more and you didn't trip once and you weren't swinging your leg around. That actually is a form of improvement, a big form of improvement. So it's not just about the time. So it's really important that you write down as many specific details as possible. And if you're doing this in the clinic with a neurologist, physical therapist, whoever, make sure they are writing down those notes as well, because if an insurance company sees that you went slower this time compared to last time, they might say, okay, PT is not working, you're done, you need to be discharged. But in reality, you are improving in your leg strength and your balance, which is shown by these written notes, not necessarily the time. So let's talk about how to do this at home. Okay, so if you are at home, the way that I like to do the 25-foot walk test looks like this. So you're going to pick 2 immovable objects. So right here, I have a closet. That closet is not going anywhere. I'm never going to move the closet or like take down that wall. So that would be a really great thing for me to use as one of my items. Now over here, you can't see everything I have over here, but you can see this chair. I'm not going to choose this chair because I might move the chair at some point. Maybe in a year from now, I might not like that chair anymore. But right beyond the chair, what I don't think you can see in the screen, is a wall with a window. Again, that wall is not going anywhere. I have no plans on renovating this house. It's going to stay there. So a really great idea for me for the 25-foot walk test could be to walk from this closet to this wall or window. And it doesn't really matter if it's 25 feet or not. You can try your best to get something that is 25 feet, but the most important thing when you're testing at home is that you just choose 2 things that are never going to move. Once you do the test, you can write down how long it is if you want to, but you could also just write down in my office, this is my office, in my office from closet to window. And what you're going to do is you're going to start near the closet, touching the closet. You can use a mobility aid if you want. You can have the walk aid on or Sionic neural sleeve, whatever you need. But you're starting here. If you have someone with you, ideally they're the ones that would press go on the stopwatch. But if you don't have someone, see if you can have a stopwatch to press go. You press go. I'm actually going to move right here. You press go and you walk to the other immovable object. Once you get there, then that's when you press stop. I personally like to do these tests 3 times and take the average, because sometimes it's just going to be slower, other times it's going to be faster, other times it might be in the middle. So if you have the energy and strength, do them 3 times and then take the average. So you just walk from one end to the other. You're not necessarily trying to walk as fast as you can, but you are trying to walk at a good pace with good quality. So that's how you would do that at home. You pick 2 immovable objects, doesn't matter what they are. It can be something in your hallway. It could be from your kitchen counter to your living room sofa. If it's like a big heavy sofa, you never plan on moving it. And you just write down what those immovable objects are so that you can repeat it the next time. MS is variable enough. We want these tests to be as repeatable as possible. The next test is the 2-minute walk test or the 6-minute walk test. Now, typically, this actually it originated as the 6-minute walk test. But when it comes to multiple sclerosis, what researchers were finding is that not all of their patients could walk 6 minutes. And then what do? If they can't complete the test, you can't technically write that down as a result. And so more research was done to see, is a 2-minute walk test just as effective as a 6-minute walk test? And they found that it was. So most of the time that I'm doing this with my clients, we're just doing the 2-minute walk test, because in reality, you're doing this on the same day as other tests. You don't want to use up all of your energy and strength just on one of those tests. So you could do the 2-minute walk test or the 6-minute walk test. In the clinic, typically what you would do is find a loop or a walkway, maybe some hallways that don't have any obstacles. And what you would do is you start at a starting point. Usually they might have tape on the ground, or you start at a wall, and you just walk for 2 minutes, either around a loop or down and back in a hallway, and they count how many feet did you walk, how many yards, what's the distance that you walked in 2 minutes or in 6 minutes if you're doing a 6-minute walk test. So that's all it is in the clinic. Sometimes they will also be measuring your blood pressure, your heart rate, your oxygen. Usually they'll do that on the first time, but not after that, assuming your vitals are within the normal limits. But let's talk about how you can do this at home. It's essentially the same thing. You just want to find one immovable object, like a closet or just something, a wall, a door, that you can then use as a starting point, and you walk away from it and then towards it, away from it and then towards it. Or if you have a nice loop in your home, the way that my downstairs is set up is it's pretty open concept. So I could walk from my living room into my kitchen, and then I loop around and I go into a little den office area, and then I'm back in my living room. So I could go in from multiple rooms if it's cleaned up without any obstacles. And so you just want to find some path that you can do without obstacles and walk that for 2 minutes. And then the way that you write down and log how far you went could either be actually measure it, what was 1 lap, and then multiply it by how many laps you did, or one thing that's a little bit easier to do if you don't actually want to measure it is just write down what loop you did or lap you did and how many times. So if I was doing this myself, I could write down in my notes, living room to kitchen to den 3 times. And that would work, because That's the same loop I would do every single time. That's not going to change. I don't really need to know how long it is, but next time I do it, maybe I'll write 3.5 times or 4 times. So it's totally up to you and what numbers you're looking for. But again, you want it to be the same thing every time you do it. So think about, what hallways do you have? Are they long enough for you to go down and back a few times, or even once or twice, depending on what your mobility currently is? Or what is the layout of your house? Could you walk between a few rooms? Or if you have one bigger room, could you just walk around the living room without running into any obstacles? So think about what type of environment you have that you could do for this test. Let me see if you guys have any questions on that one. I don't see anything in the chat for that one, so we should be good there. Okay. The next test we're going to talk about is the timed up and go. This is another one of my favorites that I like to do on the first day that I see someone, and the reevaluations, follow-ups, and then also the discharge day, mostly because it's pretty easy, but it's also one of the best ones to show or indicate if your exercises are helping or if you need to modify or advance the exercises. So the timed up and go. If you're in the clinic, what that looks like is you're sitting on a firm surface that doesn't have wheels, and you're going to stand up, walk 10 feet, turn around, walk back, and sit back down. And your PT or your neurologist will time you from the moment you start to stand up, the timer starts. Then you stand up and you go down, turn around, come back, and then from the moment your butt touches the chair again is when it stops. So again, in the clinic, you're walking 10 feet. At home, doesn't matter. That's the beauty of at-home testing. You can try to get 10 feet if you want to. If you're someone who does want to try to make it as realistic as possible, absolutely get a tape measure out, measure 10 feet, and go for it. But if you don't have 10 feet without obstacles, or if it's just easier for you to pick something that doesn't move, then that's the way to go. So let me show you what this would look like. Okay, so if we were doing the timed up and go, you want to use 2 immovable objects. So I am still going to use my closet over here. And then what I should do is grab a chair that I can move from room to room, and put it up against that wall. Because as we've previously discussed, that wall is not going anywhere. So I'm going to move a chair up to that wall. And therefore, anytime I repeat this test, I'm going to use that same chair up against that same wall. So nothing will be different. And then we have 2 immovable objects, the chair over there and then the wall over here. For today's purposes, I'm just going to use this chair, but you get the idea. So what we would do, and again, you can use a mobility aid, you can use electrical stimulation, foot drop device, anything you want. But you're going to start in a seated position, and you can start prepared. You don't have to start like reclined and relaxed. It's gonna take time for you to get up from this position, to scoot forward and then get up. So make it as easy as possible for yourself. Personally, I would suggest, start ready to go. Don't be reclining. So you're gonna start in a position where you're towards the edge of your chair. You feel like, okay, I'm ready to get up. Just tell me when. And then you or the person you're with will start a timer as soon as you start to lift up. So the timer will start. Once you're up, you're gonna walk down to your immovable object, turn around, walk back, turn around, reach back and sit, and the timer stops as soon as your butt touches. That is the timed up and go. You're timing yourself from how long it takes you to stand up, walk, the distance to the immovable object, turn around, and sit down. Again, if you have the energy and strength to do it 3 times, I always like to do it 3 times just to take the average instead of just going based off of one measurement. But that is the timed up and go. So it times your speed and your walking. It's kind of a 2-for-1, whereas the 25-foot walk test only looks at walking. The timed up and go, one reason why it's my favorite is because it looks at 2 things, the standing up and walking, but that also includes balance. It also includes you turning around, which is a very functional movement. So it just includes more movements. It gives you a more accurate assessment of your mobility in your day-to-day life versus just purely walking straight ahead. So that's the timed up and go. So the next test is the 5-time sit to stand or the 30-second sit to stand. Usually your PT or neurologist or whoever is doing this test with you will just choose one of these. They're pretty similar and pretty self-explanatory. So the 5-time sit to stand, what happens is you are timed of how long it takes you to stand up and sit down 5 times. The 30-second sit to stand, you put 30 seconds on a timer and you press go, and you're actually timing how many times you stand up within 30 seconds. So pretty similar. One is looking at the time it takes you to stand up and sit down. The other is looking at how many repetitions you can do within a certain time. Because they're so similar and you're doing this at home, I would just choose whichever one you prefer. If you think one is easier than the other, that's fine. Just make sure to do the same one every time. The main thing to know about the 5-time sit to stand or the 30-second sit to stand, similar to our last one with the timed up and go, is make sure you're starting ready. You don't want to account for the time it takes you to sit up nice and tall and scoot forward. Make sure that you're ready for the test. So the starting point really is the same as the timed up and go, where you're just sitting towards the edge of your chair, your feet are nice and wide, and you're ready to go. So if someone's timing you and they say, okay, go, you can stand up and sit down 5 times with good quality, and you're standing all the way up and then sitting down, all the way up and then sitting down, and then they stop after you do it 5 times. Or if you're doing the 30-second sit to stand, you would just stand up and sit down however many times you can in 30 seconds. The keys here being, as I already discussed, being in a ready to go position. So you're already at the edge of your seat, ready to go. And then the second thing is make sure that you're fully standing up. So often when I'm doing this with patients, their mindset is I'm gonna do as many as I can. And sometimes I'll do this, like they're not even fully standing up because they're so competitive with themselves, which I love, but make sure you're fully standing up. So to me, what that means is trying to get your butt underneath you. Instead of staying hinged, you don't just want to stay like this. You want to actually stand up and sit down. So again, making sure you're documenting and taking notes on all of this. Did you fully stand up? Were you using the armrests or not? It's fine if you do, just write it down, because as you improve, you might not need to use the armrests. And if you forgot to write it down, you might look at your notes and see 6 months ago you did the 5-time sit to stand in, just making up a number here, in 15 seconds. And now you're still doing it in 15 seconds. You might think, well, great, I haven't improved. But if the first time you used armrests and this time you didn't, that's a huge improvement. That's so much more leg strength and core strength. So write down those details. Is there any value in doing a test as fast as possible without considering form? I'm going to take time to think about this. Is there any value? I mean, yes, in the sense of, I feel like, yes, for personal value. Like if you're just a competitive person and you just want to see, let's do this. How fast can I go to get this done? Like I don't care about form. Like let me see how fast I can do it. Go for it. Like, and that might even be a little fun for you. As a physical therapist, my first thought is, yes, you could do that, but it's not really going to mean anything. Like it's not going to mean that because you're faster at this, now you can get out of your house faster, or now you can climb stairs faster, or now you can walk faster out on the sidewalk. So yes, you absolutely can do that. Again, with my physical therapy hat on, I just feel like it's not usually going to translate to real life situations as much. Maybe a little bit, but in my experience, it doesn't. So yes, there is a time and space for that, but I wouldn't do it myself. Okay, so we're just wrapping up here. So if you do have any other questions or want me to demonstrate anything again, do let me know. But The last thing that I just want to remind you and bring up again is when you're doing at-home testing, not only is documenting important, but looking at more than just what the test measures. So as we've discussed, some tests look at speed and timing you. Other tests look at distance, but you also want to pay attention to what your quality is and what your speed is. And are you using a mobility aid or not? And think about all the forms of aids and tools. Are you using trekking poles? If so, are you using 1 or 2 trekking poles, and which side of your body are you holding it on? Because that might change. If you're using a cane, what side of the body are you using the cane? When I'm doing this with my patients, I'm even documenting the percentage that they're using the cane. So as they're doing it, or not during the test, after the test, I will say, how much body weight percentage-wise do you think you were putting through your mobility aid? Whether it was a trekking pole, a cane, roll aid, or whatever. If 100% means you were putting all of your body weight through that mobility aid, and 0% is you weren't even using it, it was just pushing along in front of you, you weren't putting weight through it, where would you land? Write that down, because initially you might be putting a lot of weight through your mobility aid, but towards the 6 months testing mark or a year testing mark, maybe you're using it very little. So are you using a mobility aid? If so, how much? And are you using any ankle brace, AFOs, electrical stimulation, anything that you can think of? Write it all down. And keeping in mind quality versus quantity, write down both of those things. When you're documenting, not just quality and quantity and mobility aids, what time of day was it? You want to take consideration of the things that MS can be so variable with, right? You might have more energy in the morning or early afternoon. So if you do this test at that time, you're going to score better, versus if you're doing this test and you remembered last minute before dinner and, oh my gosh, I forgot to do this earlier, let me do it now. Or maybe around dinner time, you don't have as much energy. And it's fine to do the test at that point, but write down that you did it at 6 p.m. or whatever time it was, because the time of day might play a factor as well. Did you use your hands as you were going to sit up from any of the sit to stand tests or the timed up and go? Again, it's totally fine to do that, but just write it down. The idea is write down as much as you can, so that when you're doing a test again in 4 weeks or 6 weeks or 8 weeks, you can try to do it the same as the way before, regardless of what type of MS day you're having. And writing down what type of MS day you're having. If today feels like a fatigue day for you, write that down. If it feels like a great day, write that down. There's no such thing as writing down too much. It can be so helpful in helping you track your progress throughout the weeks and months and even years. Ideally, this is something that you would do every 4 to 8 weeks or so. Just keep it on a piece of paper, put it away. Again, you're not really going to be able to get strong notes that mean much until I personally think about the 6-month mark, because MS is so variable. And the last thing I want to mention is that these tests, when done at home, there's so much room for error anyways compared to in a clinic. So the more you write these things down and the specifics and the walls that you're using and the chairs that you're using, the better, because there's so much room for error anyways. Let's try to make it as similar as possible to reduce any error. So I did just want to mention, I have, and you will have access to this recording as well, but I have an app called the Missing Link app. It's actually called the Missing Link Courses app. And I have instructional videos for each of these tests. It's a free app, but it gives you a place where you can review each video, each test individually, and track it. If you have signed up for any of my courses, my 5-day challenge, a lot of people know about Missing Link, whatever it might be, you'll just log in because you already have a username and password. If you've never signed up for any of my things before, Missing Link, the challenge, a webinar, anything like that, then you'll create you'll have to sign up instead of just logging in. But when you log in, you'll see this thing that says track your progress. So you just click that, and that's where you'll be able to find all of this information. Okay. So these are all the places that you can reach me. You've got my email. My missing link is my website where you can find all of my resources. The Missing Link podcast, YouTube is Dr. Gretchen Hawley, and my Missing Link book and audiobook. I'm going to stop sharing my screen and answer any questions that you have. Okay, I try to do sit to stand more slowly in order to work more muscle. So one thing too is sit to stand is a great exercise as well. So today we're talking about sit to stands with the mindset of testing these functional outcome measures. But you can also do them as an exercise of going slow and steady, and you're not timing yourself. Absolutely. The dynamic gait, so I didn't include that one because it's more intricate, but let me pull it up for you. So the dynamic gait index is a little bit more complex, which is why I mentioned it on one of the first slides, but didn't mention it later. So the dynamic gait index looks at your balance during gait and functional activities. And basically the outcome of the test is supposed to be an indicator of, are you likely to fall or not? So generally it takes about 15 minutes. I would actually say in real life, the test actually takes more like 30 minutes. So oftentimes this one is not done on the same day as the other ones that we've mentioned because it just takes a while and it takes a lot of energy. But there's, let's see, how many are there? 8. So there are 8 different tasks that you need to do, and that usually it's with your physical therapist. They will have you do this task and then they're going to grade you. So it's kind of a combination of a subjective and objective outcome measure. It's subjective because of the questionnaire that the PT is filling out, but it's objective because you're physically doing the test. So kind of a combo, but I'll give you a few examples. So number one, the first function activity that you'll need to do is walk on a level surface. So the instructions that your physical therapist will give you would say, walk at your normal speed from here to the next mark, and they try to make it about 20 feet. And you just walk that distance. And then the PT is analyzing, okay, how did that go? So you would get a score of a 0, indicating severe impairment if you can't walk 20 feet without assistance or with severe gait deviations or imbalance. You'd get a grade 1, which would indicate moderate impairment if you can walk the 20 feet, but it's a slow speed, abnormal gait pattern, or evidence of imbalance. You'd get a score of 2 if it's a mild impairment, meaning you can walk 20 feet, you're using an assistive device, it's a slower speed and mild gait deviations. And you'd get a score of 3, which is the best score, which would be normal essentially. It means that you walked 20 feet, no assistive devices, good speed, no evidence for imbalance, and a normal gait pattern. So it goes through 8 different tasks, and your PT is watching specifics about you. And therefore, this is kind of a hard one for you to do at home because you're not watching yourself. You need another set of eyes. So if you wanted your significant other or someone that you live with to do it for you, you could, but there's a really high room for error here if they're not a trained person, because they might be looking at something different last time than this time. But I'll give you another example. I'm going to try to find one of my favorite ones. Change in gait speed is another one. So you begin walking at your normal pace for 5 feet. And then when I tell you go, walk as fast as you can for 5 feet. And then when I tell you slow, walk as slowly as you can for 5 feet. So it's up to the physical therapist, tell you go, slow. And so you're listening to them and you go faster and then you slow down. And we're looking at how did you do? How was your gait when you were changing speeds? So similar to before, grade 0 means you can't change speeds or you lost your balance. Grade 1, you only had to make minor adjustments to your walking speed. Mild impairment for grade 2, you're able to change speeds, but there were mild gait deviations. Grade 3 is normal. You were able to smoothly change walking speeds without loss of balance or gait deviation. So just to give you other examples, another thing you'd have to do is walk, but turning your head. and the PT will tell you, okay, turn right, turn left, and we're looking at how does your gait or your walking do as you are walking and turning your head. Same thing, but walking with looking up and down. Another one is walking and pivoting. So you'll walk, and then when the PT tells you turn, stop and turn, you'll stop and turn and walk, kind of like the timed up and go. So you add in that turn, what happens to your walking. Another one is you have to step over an obstacle. So you'll just walk at your normal speed, and then you'll have to step over a box or over a shoe or something. What happens to your gait when you have to step over something? You have to step around an obstacle, and then the last one is stairs. So again, that one's I usually don't recommend doing this one at home because there's so much room for error. You do need someone else to be intricately watching you walk and looking at all the specifics of your gait. It's very time consuming, but it is one that if you do in the physical therapy clinic or neurologist clinic, it is one that is shown to be a good indicator of your balance and potential fall risk. My elbow bursitis with such extreme pain says a lot. Yeah. I don't know if this is what you were referring to, but oftentimes the way that you'll know if you're putting a lot of weight through a mobility aid is if you have elbow pain or wrist pain, shoulder pain, neck pain. Yeah, it's a good sign. But the good news is you're aware of it, and now you can do exercises to work on putting less weight through your mobility aid. I don't see any other questions. I know we're right at the end of our time here. This one worked out well. We've been going over for a few, but let me know if there's any other questions. Go ahead and put them in the chat. I'm happy to answer them. Thank you so much for explaining all of this. You're welcome. Oh, the last thing that I do want to say is you do not have to do all of these tests. If you were to do all of these, especially all in one day, not only is it going to take some time because you're doing 3 of them, you're taking the average, but it's probably going to be fatiguing, and there's just not necessarily a need to do all of them. So you could spread them out throughout a few days, or just pick your favorites. If you are working on walking faster, then you might want to prioritize the timed 25-foot walk test. But if you don't really care about speed, maybe you care more about turning and balance and functional movements, the timed up and go might be a better fit. That one is still looking at time, but it's looking at time as you're moving with the standing up and turning, so it's more functional. If you're not really working towards walking, but you are really working towards leg strength, maybe you do the 5 times sit to stand or the 30-second sit to stand. If you're not really working towards walking or strength, but you really want to keep track of your fatigue, or you do want to keep track of your walking, but in the questionnaire form, then that would be more of the Modified Fatigue Impact Scale or the MSWS 12. So you don't have to do all of them. I just wanted to share with you the ones that are, according to research, the best ones to indicate your progress with physical therapy-based exercises and potential improvements, regression, or maintenance with your MS, and that can be easily done at home. So those are the ones that we did today. Need an exercise for the bursitis. If the bursitis in your elbow is due to putting too much weight through your mobility aid, I actually have a podcast episode for my podcast is called The Missing Link, spelled The Missing Link. It's episode, I want to say it's episode 176. I don't know why I think that, but it's all about how to transition from using one mobility aid to a lesser mobility aid, and therefore it reviews how to take weight off of your mobility aid. Because the thing that you need to focus on isn't necessarily don't use a mobility aid, it's don't use it as much, but you have to work towards that over time. It's not just as simple as, oh, okay, I'm just not going to use it as much. So you have to work towards that. Let me confirm the episode number for you. Okay, 146 is the episode, how to transition to a different mobility aid. That's the one. So it's Missing Link podcast episode number 146. Okay. All right, well, I will let you guys go. I don't see any other questions coming in, so I will let you go. Thanks so much for tuning in, especially at this newer time. I feel like we've done this for a few months now, but thank you so much for tuning in, for participating in the questions and chat box. It's always fun to know that you guys are there and to be able to answer your questions and tweak the webinar to exactly what you need and what you're looking for. So thank you so much for tuning in. Thank you to MS Views and News for collaborating with me to offer this to you guys, and to our supporter, Viatris. And I will see you guys next month on November 11th to talk about bad habits that are caused from weakness in MS. Have a good day, everyone. Thanks again.